So today we're going to focus on palpation of the lower extremity. Please understand that all of the muscles that we're going to be looking at today, glutes, hamstrings, gastrocnemius, and soleus, these are all very powerful muscles. It's important to also remember the specific actions that each of these muscles performs to make the muscle contract to make it easier to find it and to palpate it correctly. So I'm going to start with glute max, gluteus maximus. Let's talk about origins and insertions, and then I will palpate it. So we need to remember that the glute fibers kind of run at a diagonal like this. So your origins are going to be the edge of the sacrum, the tailbone, the coccyx, right here, and also the posterior iliac crest. They will come down at a diagonal, and the upper fibers of glute max will blend in with the IT band, which runs here on the lateral thigh, and the lower fibers of glute will blend in and attach to the gluteal tuberosity on the posterior side of the femur. Glutes are a very powerful hip extender. So if my client would just raise their leg off the table briefly, good, you can see all of those glute fibers contracting. So go ahead and relax that hip for me. So remember, if we're going to palpate a muscle, we have to palpate perpendicular to the fibers. So if the fibers are in fact running at a diagonal this way, I'm going to be palpating this way. With regards to glutes, also remember that there is adipose tissue. So we're needing to get through the adipose tissue to get to the muscle. So what I would do, and also make sure that you're not too high up here because this is going to be glute medius here. So what I would do is maybe find the PSIS and slide off of that diagonally. Right here is that edge of the sacrum. So I need to, again, sink through adipose tissue, and then I'm going to palpate at a diagonal. I will move my fingers down at that diagonal, going towards that IT band, because I'm on the upper fibers here. Good palpation tool as well. Reinforced finger pads. So those are the upper fibers. I'm going to move my fingers down slightly, and I'm going to catch these lower fibers, and they're going to run towards that gluteal tuberosity. Just, again, sink through adipose tissue first, back and forth, back and forth. Now, there's also another muscle that's deep here that we will show you at a later time that attaches to the greater trochanter and to the side of the sacrum, and that's piriformis, and it runs at a diagonal like this. But if we are far enough down at an angle like this and far enough down at an angle like this, sinking through adipose tissue will surely contract and palpate correctly gluteus maximus. The second gluteal muscle that we're going to focus on today is glute medius. It's actually kind of a pie shape if you think about it. The landmarks that you need to think about are the iliac crest, which runs right here, and you're talking about the posterior side of the ilium, so we can call that the gluteal side of the ilium. And then also you want to find the greater trochanter right here, which is part of the femur. So if you think about it, if we're talking about the iliac crest, it's kind of a pie shape. And if my client would abduct, just slightly abduct, we're going to see that muscle contract right here. Go ahead and relax for me. Another thing to remember about glute medius is some of those fibers are actually deep to our glute max back here. So we'll only be able to catch part of the fibers as some run under that bigger muscle. So other thing that you need to remember here is if you find the ASIS just posterior to the ASIS, this muscle right here is TFL. So you need to be posterior to TFL, and you've got to be just above the greater trochanter and below the iliac crest. So if I find that ASIS, here's TFL, move posteriorly, here's the greater trochanter, I'm right between all of my landmarks. So if I again would have my client abduct their hip, it bulges right into my fingers, they'll relax, and then I can palpate this way. I can move posteriorly. And then again, I'm going to run into glute max fibers back here, but I can catch one more edge of glute medius right here. So if you think about it, from here to here, they come down in a wedge. I palpated in 3 places. Another important set of muscles on the posterior thigh are going to be the 3 hamstring muscles. Now, one thing to remember about the hamstrings is we look at the posterior thigh and we think all of this is going to be hamstrings. But hamstrings, which all originate up right at the ischiotuberosity, are actually a very narrow set of muscles that come down like this, because you're going to have vastus lateralis on the lateral side here, which is a quadriceps muscle, and then you're going to have all of the adductor muscles over here on the medial thigh. So again, just remember that this is a narrow group of muscles. So let's show what each of these 3 muscles would be and what their general location is. So they all start up here at the ischiotuberosity. Biceps femoris runs this way and attaches to the head of the fibula. That is the long head of biceps femoris or femoris. There is a short head that attaches to the lateral linea aspera and also blends into that head of the fibula. The other 2 hamstrings are semimembranosus and semitendinosus. They will come down the medial side of the thigh. Tendinosus will be the one that is more tendinous. It will be the one that's more visual and obvious. It will come and attach to the pes anserine on the kind of the medial front part of the knee. And semimembranosus will come down and attach to the posterior side of the medial condyle of the femur. So this muscle, or these 3 muscles I should say, 2 important actions that they do. I'm going to ask my client to extend the hip and hold it there so we can see those hamstrings firing here. Relax. And they are also very powerful knee flexors. So if I had my client flex, again, here they are, and as I pointed out, very narrow down the posterior thigh. Relax. Okay, so let's do each one of those hamstrings. Let's start with biceps femoris, the most lateral one. So if I were to ask you to show me general location, you can find the ischiotuberosity, which is right here. It's your sit bone. It's what you sit on. And the head of the fibula. Run your hands, fingers down to that. Now if you'd like, because this is a knee flexor, have the client very gently flex their knee, and you're going to notice a very, very prominent tendon right here, right on the lateral side of the knee. So you can actually start your fingers there. I'll ask my client to relax. Reinforce fingers. And I'm just going to kind of pull back on the muscle. I'm not going to necessarily go back and forth. I'll just pull across, pull across, pull across. And again, make sure that you're not coming this way. Your goal is to get back up to that ischiotuberosity. And if you lose it, if you're like, I'm not really sure that I'm on it, I'll hold my client's ankle down. He will flex that knee. It pops right into my hands. Relax. And continue up to the ischial tuberosity. All right. The other two, the semis as they're called, semimembranosus, semitendinosus. Something that will also make this easier is semimembranosus is a little bit wider as it comes down to the posterior condyle. Semitendinosus is going to be that very prominent tendon, much like biceps femoris on this side. So let's start with membranosus. Again, if I ask my client to flex their knee just a moment, I'm going to see that tendinosus right here. And they'll relax. And I will even see that nice flip of semitendinosus. And if you flex your knee again, it comes right into my hand. Good, relax. That all the way up. If I want to just verify it one more time, do that knee flexion for me. Again, it's right here. Good, relax. And I'll go all the way up to that ischial tuberosity. All right, now for membranosus, which can be a little bit more complicated to find, good way to think about it is if this is membranosus, tendinosus is sitting right on top. So you'll be able to catch membranosus on either side of the very prominent semitendinosus. So I'll have my client flex their knee again. Here is tendinosus. So on either side will be membranosus. Let's go ahead and relax for me. And I can catch membranosus here, membranosus here. And as you get up towards their origin, these two muscles are going to really kind of blend together and be a little bit harder to discern the two. But if I want to catch the inside of membranosus, I know that tendinosus is here. I can get the inner part of membranosus right here. Have my client one more time, flex that knee, I'm right on it. All the way up to the ischial tuberosity. There are two important muscles on the lower leg that we're going to talk about at this time. General location of both of these muscles is basically around the posterior portion of the knee, and they're going to come down to the calcaneus, which is that heel bone. Another important thing here is this calcaneus or calcaneal tendon. Sometimes it's referred to as the Achilles tendon. So we're going to look at gastrocnemius, which is here, and soleus, which lies a little bit deep to that and then comes out, and they both will come down to that calcaneus. So let's look at gastrocs first, or gastrocnemius. Two important actions of gastrocnemius is knee flexion and plantar flexion of the ankle. Now, because gastrocnemius attaches to the posterior condyles of the femur, they will have that action of knee flexion. So a nice way to show me general location is posterior condyles of the femur. You can kind of do your fiber direction almost like you do deltoid, and just kind of bring your hands down like this, narrow them onto the Achilles tendon, and then stop at the calcaneus. One thing that we do need to make sure though is that gastrocs is actually two muscle bellies. There's a muscle belly here, and there's a muscle belly here. One other thing to remember about gastrocs is the medial portion, or the medial belly, actually is a little bit longer than the lateral belly. So knowing general location now, I'm going to ask my client to plantar flex his ankle and you're going to see this nice big muscle right here just pop up. Here's that medial belly and that lateral belly. So I'm just going to grab around the muscle, have my client relax, and I've got all of the muscle right here. If I wanted to make that a little bit more specific, I can grab the medial belly here, get a nice flip of that, because this is a superficial muscle. And then I can also grab the lateral belly and get a nice flip of that lateral portion too. So that's gastrocnemius. Now soleus does not cross the knee. So where soleus attaches is that soleal line. It's kind of an angle. The proximal posterior surface of the tibia and the posterior surface of the head of the fibula. This is a wide muscle. It's wider than gastrocnemius, but it is under gastrocnemius, so it's very wide, and it's going to come down, kind of come out from underneath gastrocs, right at those where the muscle bellies end for gastrocnemius, and then continue and converge into that calcaneal tendon down to the calcaneus. So a nice way to get soleus so that you're not palpating gastrocs is to bend the knee. Now by bending the knee or flexing the knee, that's going to ensure that gastrocnemius is for the most part going to stay a little bit flaccid. It's not going to be contracting as much as soleus will be. So when I ask him, he is going to do plantar flexion, and I'm going to apply some resistance to that. So what I will do is find the bellies of gastroc, kind of widen my fingers. So if I can have my client plantar flex their ankle, nice, thank you. Right here is soleus, just on that medial edge, and relax. Okay, and again, because I have flexed the knee, gastroc really isn't doing anything. And on the lateral edge, if I find the belly of gastrocs, have my client plantar flex their ankle one more time. Good, thank you. Relax. And I can catch the lateral edge of soleus here. And again, I'll set his ankle back down, and they converge, blend in, and attach to the calcaneus. Anterior lower extremity, we also have another powerful set of muscles called quadriceps. So general location of your quadriceps are going to be here, and they're all going to attach just distal to the patella onto the tibial tuberosity, which is right here. Now, one of the quadricep muscles also attaches up near the hip, and that is rectus femoris. Rectus femoris is going to come down straight like this. Vastus lateralis is actually going to start on the lateral lip of the linea aspera, and those fibers are going to make their way like this. And vastus medialis is going to start on the medial lip of the linea aspera, and they're going to come in this direction. So as I said, they're all kind of converging down like this onto that tibial tuberosity. So let's start with rectus femoris. What I want to do is locate the ASIS, anterior superior iliac spine. That is not where rec fem attaches. It actually attaches just below that on the AIIS, or the anterior inferior iliac spine. Now, if I want to make sure that I am already on that muscle, I'm going to ask my client just the tiniest bit to flex your hip for me. And that muscle pops right into my fingers right there. So go ahead and relax. So to find that muscle, find the ASIS, come down about an inch, inch and a half onto the AIIS. It's going to be a little bit difficult to discern that AIIS because of all of the tissue that is on that. But if you hold here and then come and put your finger here for the tibial tuberosity, and then just kind of draw your fibers in like this, that would be rectus femoris. So I'll start my palpation here. I'll ask my client again to just barely flex that hip for me. Pops right into my fingers and relax. And I can go across rectus femoris here. And I'm going to make my way down. And just something to keep in mind as you're going down, you want to just kind of stay in a straight line with the patella because you're going to eventually get to that tibial tuberosity. If I want to make sure, I'll just ask my client to slightly flex that hip again for me. Know that you're on it, relax. Thank you. And you want to move kind of slow and deliberate and not with too much movement as you go down because you don't want to flip off of the muscle. So it's just going to be these back and forth movements as you come down the belly of rectus femoris. So let's look at vastus medialis, which is going to be on the medial side of the knee. And again, one thing that I need to also mention is all of these quadricep muscles that converge here are very powerful knee extenders. So if my client's knee was in flexion and he was to extend the knee, that's the main action of all of these quadricep muscles. Now, what is going to make vastus medialis pretty easy to find is it has a teardrop shape. It's kind of shaped like a teardrop. And the reason that it is shaped like a teardrop is it is nestled or situated right between rectus femoris and there's another muscle, it's the longest muscle in your body, called sartorius that comes across and down like this onto that pes anserine. So you can see how this vastus medialis would make a teardrop shape. So to find that, if you want, you can place your knee under the client's knee, and that way I have some room for him to do a little bit of knee extension. So this is where we're going to be looking, and we're going to be looking for that teardrop shape. So if I could have my client extend his knee like he's kicking a ball, you'll notice it's right here, nice teardrop shape. Go ahead and relax. Now those fibers are coming in this way. So to palpate perpendicular, I'm going to be palpating across the muscle this way. So this is vastus medialis. And again, if I want to be sure that I'm on it, I'll have my client extend that knee for me. It contracts right here, relax. You could also use thumbs if you wish. Vastus medialis. So the larger of the quadricep muscles, which lays on the lateral side of the thigh, is vastus lateralis. So those fibers kind of run at an angle like this, and then with regards to its insertion, it inserts down here at the tibial tuberosity with all of the other quadriceps. And remember that rectus femoris comes right down the center of the thigh. Vastus lateralis is coming at an angle. So knowing that angle, we want to palpate the fibers. Remember that the IT band runs down the thigh here too and attaches to the tibia. So we can actually access the vastus lateralis on both sides of that IT band. Remember that the vastus lateralis, along with all of the quads, main action is knee extension. So if I was to hold my client's ankle and have him extend, because he's going to try and straighten his knee against my resistance, relax, do that action again, the muscle is going to contract right here. I'm going to have him relax. And just to make sure that I get the all of the muscle, I can palpate right here. I can move my way down the thigh. Get a nice kind of flip of the muscle here. Again, so if the muscle is coming at an angle, if I just kind of have my fingers here, I am going across the fibers. So right now my fingers are just kind of situated between rectus femoris and the IT band. Use maybe a reinforced finger pads. And then again, just on the other side of the IT band, I can access the muscle here. If I had my client extend the knee one last time for me, I feel those fibers contract. Now we also need to be careful because back here is the hamstring group and biceps femoris is right here. So this part of vastus lateralis is right behind the IT band, but right in front of biceps femoris.